Right now, the day's biggest news stories from a Vegas perspective. This is the Vegas Take with Sharp and Shapiro. 1, 2, 3.
All right, welcome back. It is the Vegas Take. Sharp and Shapiro with Chris Wynn joining us on a Monday. We're all losing our mind here, folks. Check us out on our YouTube page as well, which is the Vegas Take, where you can see our pretty mugs. Broadcasting live from Brian Shapiro's kitchen, by the way, but we're doing the best we can to provide you the best information and some, hopefully a few laughs and some entertaining radio. We do the best we can, and of course we always want to hear from you as well. Here's something that we haven't brought up yet this show that I think is extremely important. Dr. Fauci has not always seen eye to eye with the President of the United States. Now, when it comes to this virus, I would rather listen to the scientist and to a man that has the experience that he has than any politician, not just Donald Trump. So with that being said...
Are you sure about that, Brian?
Yeah, let me just get to the audio.
Okay.
With that being said, yes, and I am sure about that. Dr. Fauci told CNN's Jake Tapper that lives could have been saved if the country shut down in February. There was some pushback. Have a listen to this.
You know, Jake, again, it's the what would have, what could have. It's very difficult to go back and say that. I mean, obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had right from the very beginning shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down.
All right, so he's saying there was a lot of pushback. He didn't necessarily mention Donald Trump's name, but then Jake Tapper asked him about reopening the country. Here's what he had to say about that.
You know, Jake, that's a great question, and that's really what I was inferring when I said a rolling reentry. It is not going to be a light switch that we say, okay, it is now June, July, or whatever, click, the light switch goes back on. It's going to be depending where you are in the country, the nature of the outbreak that you've already experienced, and the threat of an outbreak that you may not have experienced. So it's going to having to look at the situation in different parts of the country. Obviously, New York, who went and is going through a terrible ordeal, is going to be very different from Arkansas, and you'll hear from the governor shortly, and very different maybe from some places on the West Coast, like Washington State, which have been successfully able to prevent that big spike. I think it's going to have to be something that is not one size fits all.
Okay, so that is Dr. Fauci in regards to the comments he made with Jake Tapper on CNN. I will also tell you that yesterday, after this interview that he did with Jake Tapper, Donald Trump decided to retweet something with the hashtag saying, "Fire Fauci."
Now, do you know why he did that, Brian?
Well, I haven't talked to the president.
Okay. Well, Anthony Fauci went on a show on February 29th, and again, now on January 26th, he also said, hey, everything's going to be fine. On February 29th, he went on a different program, and tape came out of him literally telling the American public not to change anything about what they are doing. And then 4 days later, Mayor Bill de Blasio says the exact same thing. Donald Trump is getting his information and has gotten his information from Anthony Fauci, the infectious disease expert from day one. As far as the rollout of the economies predicated on whether they're a hot spot or not, I 1,000% agree with that. I think that is the only possible way you can open up this country.
All right, so Chris Wynn has a little update on this Fauci firing. Chris, go ahead.
So J.D. and Brian, of course, we've been monitoring Twitter across the board here. And Jim Acosta, he's the White House correspondent for CNN. I know we have a lot of fans of him that are among our listenership. But Jim Acosta just tweeted out, the White House says, quote, unquote, media chatter about Trump firing Fauci is ridiculous. Reality check, though. Trump fueled these rumors with chatter when he retweeted somebody saying fire Fauci yesterday. So it's significant to note that that's out there as far as the President of the United States, his reaction, and why a lot of people believe that it could be a possibility that Dr. Fauci could be heading out the door.
No, I actually think that based on Donald, just from what I know about Donald Trump, when he does something like that, there is a reason for it. In my opinion, he is much more calculated than people give him credit for. I don't believe Anthony Fauci will be with Donald Trump for a much longer. I don't believe you'll be seeing much Anthony Fauci. Now that could be a firing, that could be a process where he's just not being put up in the public eye, where a whole new task force is put together to actually open up the country. But I believe that we're not going to hear a lot from Anthony Fauci in the near future. That being said, I think that open up the economy based on positive testing rate is the best possible way to do it at this point. You go to New Jersey, New York, Detroit, Louisiana, even Massachusetts, Connecticut, the place where your friend's mother died. The testing rate there the positive testing rate is almost 30%, Brian. Here in Nevada, it's 9. California, it's 12. Washington, it's 9.
What is your
Nebraska,
point,
it's 5.
We should
Iowa,
reopen
it's 10.
the strip?
No, I'm not saying we should reopen the strip. Now, what I think we probably are going to do is that we are going to open like the stations casinos, the local casinos. I think those will be open.
Right
probably.
now, you're okay with that?
Not right now, but I'm saying March or May 1 to May 15. I think that is going to take place. I don't think the strip will be open to the public until June. And I think that'll take place. It'll be based on a system of where people are in the country that aren't in hot spots. For example, if the Texas economy, which has a 9% testing rate, if that gets opened up along with Utah and Arizona and Washington or Iowa or Nebraska or Missouri or Arkansas, kind of like Anthony Fauci said, because the chances of someone coming to Las Vegas and being an asymptomatic carrier of the virus are very, very small there. Because keep in mind, when you have a testing rate under 10%, that right now it's very hard to get a test in the United States, and that's been proven. And unless you meet specific conditions and you have severe. Well, actually, it is and it isn't, because had the actual.
How is it not problematic for people to not able to get tests?
Because
How
what
do you
that
answer the question like
because
that?
Brian, what that would do is that would actually drop down the mortality rate. Like
Who
for example,
cares? It's the right thing to do.
are you gonna let me finish, man?
You're not making sense.
Wait,
though.
why are you interrupting me?
Well, because you've been going on for 5 minutes.
I know,
That's why.
I've been going
I've
on for 2.5 minutes, actually.
Okay, well,
you go on 7 to 9 minute rants 4 times a show. Do you know that?
That's my job. I'm the host.
So
that's
am I.
my job.
So am I.
Well, okay, fine, go.
Okay, no, you go. No, you go.
Okay, we got a little bit away from what we're talking about, though, is Dr. Fauci and the White House and their approach to Dr. Fauci. And I wanted to ask you the question, J.D. I want to ask you simply flat out, do you agree with President Trump if he decides to get rid of Dr. Fauci, who is, at this point, the premier authority when it comes to infectious disease
now,
in this country?
Do
you agree with it?
Now, I will say that we shut down the country. Why?
We shut down the country for mitigation, right? That's the main reason.
We shut down the country
because we have a global pandemic.
Because IHME modeling, the modeling that was presented to the American public, showed that 2.2 million people could die.
Exactly.
If we didn't do actual mitigation.
Yeah.
Now that number is down to 60,000.
Understand. Yes.
That number,
well, that's the projected number.
You're right, and right now it's at 23, and the number has dropped. Okay. Our peak was supposed to be on Saturday. We had 2,035 deaths. As of yesterday, we had 1,520. The deaths dropped 25% in 2 days, which is a sign of good thing. Also, if you have this virus and you're asymptomatic, you're not going to carry it for more than 30 days. You're going to carry it for probably 20 to 24 days. We've been in lockdown for roughly a month, so a lot of the cases that were asymptomatic to start have not been identified because they haven't been tested, because they're not testing everybody.
I understand that.
Yeah. But those cases, those people have recovered from the virus already, Chris.
Okay, but I'm asking you the question: do you think he should fire Dr. Fauci? Do you think that the White House should separate themselves from Dr. Who a lot of us have been listening to, right?
I think that the country was shut down based on incomplete information and incomplete data, which it was, because we don't know when the virus got here. We don't know the actual mortality. We don't even know how often it affects people.
JD, on that.
And,
it's already done.
And also,
we already shut the country down.
I agree with that, Chris. But right now you've got 20 million people unemployed in the United States.
We know that.
The rate in Las Vegas, you have roughly 300,000 people unemployed in Las Vegas. You have a collective 112 deaths. What does that mean? That means that for every 2,800 people that are unemployed, there has been one death in the entire state of Nevada.
So you think Dr. Fauci should be fired?
That is,
Donald Trump and the White House
I am saying that, in my opinion, right now, Anthony Fauci, because what he's doing is he's looking at IHME modeling, which is it's Washington, it's funded by Bill Gates, which it is, but he is looking at that modeling and he is using that. That has been used to shut down the country, and as of now, that modeling has not been correct. And the fact that Anthony Fauci did not put any blame on Donald Trump yesterday, in my opinion, he tried not to answer that question. That was totally spun out of control. But he did say yes. In hindsight, of course, had we shut down the country earlier, things would have been different. And CNN ran with that and say, he's blaming Trump. But then the video came out on February 29th of Fauci literally telling the American public that, you know what, no, everything's going to be fine. This is going to be okay. So I think that Anthony Fauci has not been correct, but I'm not holding that against him because this is a novel virus. He was not alive during the Spanish flu. There's been nothing like this in 102 years, and it all started with misinformation, not only as far as the human-to-human transmissible element, as far as the efficiency, the element of it, from China, as well as the amount of cases that were taking place in China. So I think that it's such a fluid situation that I can't really hold him totally accountable for it, but I will say this, I think it's more on Anthony Fauci at this point than Donald Trump, because Anthony Fauci, the infectious the disease specialist of the world, has been feeding Donald Trump information and tell the public since day one, and for the most part, he has been wrong.
Okay, so I'll take that as a yes. You think that Dr. Fauci should be separated from the White House? That's pretty much, you went the long way around it, but I think that's pretty much your contention, right? Dr. Fauci should no longer be part of the COVID response team.
I would say that
right
I would not have a huge problem with it personally.
All right. Well, that's I'm obviously there's a lot of people that would disagree with that, but Brian, this is a situation where the rubber's going to meet the road here, and you're talking about obviously the country being shut down. It appears to me now that you're trying to tell me that we should have shut the country down. It appears to me that is your opinion, is that we should not have shut the country down. And look, there's just a lot of professionals, a lot of public health professionals, a lot of doctors, a lot of scientists, a lot of researchers that would absolutely, utterly disagree.
And I will tell you this,
a
recent study, an antibody study was done in Germany, a major one. 80% of the population was studied. And they came out that 15% of the population had antibodies to the virus. The actual mortality rate applied after the fact, when considering the mild and asymptomatic cases, ended up being 0.37%, which is 3 to 4 times more.
I get you're giving me the numbers,
which is 3 to 4 times more deadly than the flu. The conversation was, like, for example, Spanish flu was 36 times more deadly than the standard flu.
Yeah.
And the conversation was this was 10 to 20 times more deadly. And right now, it is becoming relatively obvious that is not the case.
What are you talking about? That's not.
JD, you're throwing a lot of numbers.
I'm
actually
not.
Let me talk. I'm actually not.
Absolutely.
Okay, I haven't said one word for 10 minutes. I've gotten up. What you just said is not true. It's just not true. If this virus is 1% deadly, which, by the way, right now it's higher than that, but if it was 1% deadly, it would still be 10 times more deadly than the flu. So why is it that you just said that why are you comparing it to the flu?
I'm saying there was an antibody test done. Do you know what an antibody test is, Brian?
Of course I know what an antibody test is.
That means that it looks at your blood. It's a serology test, and it tells the doctor or tells whoever's looking at it if you have antibodies to the virus, which means you've either had the virus or you haven't had the virus. And I'm saying in one place in Germany, 15% of the population had antibodies to the virus. And comparing that to the actual death rate in that place in Germany, the number would have been 0.37%. The actual fatality rate would have been 0.37%.
I just want to kind of make a bridge here, Brian. I want you to comment on this because JD, basically what he's doing right now is making the case that we should not have shut down the country, right? You're making that case right now. That's why I want Brian to respond to it, because that's exactly what what your words mean right here.
Well,
right?
First of all, let me and I got to play some audio, but before I do that, let me just say this. I believe shutting down Las Vegas and the Strip and shutting down non-essentials throughout the country has saved possibly millions of lives. And what we fail to understand is the information that Fauci put out there and the experts put out there has saved lives. And we talk about, the death rate. I hear from the alt-right. It's only 60,000 now. Well, why is that? I would beg to tell you a big reason why the death rates – now, one death is too much.
That's a projection, by the way. That's not
a big reason why those numbers are –
It's 33% of that right now.
A big reason and why that number is down is because of people practicing social distancing and listening to the experts. Now, I have some audio I would like to play for you because I think it is very dangerous, in my personal opinion, to compare this to the flu in any way, shape, or form. However, some people are still doing it. Fox News contributor Bill Bennett is comparing the coronavirus outbreak to the flu. He said this on Fox News earlier this morning. Have a listen to this.
Yeah, let's take a step back. The estimates now from the University of Washington, which is the model everybody's been going on, even though it's been wrong most of the time by a lot, overstating it, is now they say 60,000 people will die. 61,000 is what we lost to the flu in 2017 and 2018. The flu. Now, we all regret the loss of 61,000 people, if that's what it turns out to be. I'm going to tell you, I think it's going to be less. And salute all those who are working on the front lines on this, the hospital workers, the nurses, the doctors, et cetera, and the generosity of the American people. But if you look at those numbers and see the comparable, we're going to have fewer fatalities from this than from the flu. For this, we scared the hell out of the American people. We lost 17 million jobs. We put a major dent in the economy. We closed down the schools. You heard Dr. Oz say we probably didn't have to do that. Shut down the churches and so on. This was not and is not a pandemic, but we do have panic and pandemonium as a result of the hype of this. And it's really unfortunate. Look at the facts.
Okay, let me just say this. Bill Bennett is not only a complete fool, but he should be held criminally liable for those ridiculous statements. I'm serious. Those ridiculous statements that he just made. First of all, let me start by saying, number one, the entire country, if continued to be in lockdown, there would probably still be 60,000 deaths. For this moron to go on, and by the way, what a shocker, he's a Fox News contributor, to today, not 2 weeks ago, not a month ago when Devin Nunes was saying, go to the restaurants, have a good time. He said it today. Today he said that. And all the issues, and by the way, for anybody to say this is not a pandemic, was on the short bus. Okay, that's the best way I could prove it.
It's clearly a pandemic.
Okay, obviously. And this guy goes on Fox News comparing it to the flu, continuing to undermine this virus while talking about the economy. I am sick and tired of these people. Bill Bennett, you're a criminal. You should go to jail for those comments that you made on Fox News. People are going to listen to them. The people on the right that are gullible are going to listen to this fool, Bill Bennett, on Fox News this morning saying, oh, it's not a pandemic. It's just like the flu. Does this idiot not understand that his words mean something and it matters that there are people out there that are going to listen to him and say, oh, that guy Bill Bennett, he was on Fox News. He's a great contributor. You know what? This is just like the flu. Then they're going to go out there and then they're going to give it to their parents or grandparents, and there's going to be more deaths if we listen to this moron Bill Bennett. I am so sick of people like Bill Bennett. They have been undermining this virus for months. They continue to undermine it, and they should be held criminally liable as far as I'm concerned.
He's not undermining the virus and comparing it to the flu, Brian.
That's what he just said.
I just did the exact same thing, actually.
That's what he just said.
I said, and I believe this.
He said it's not a pandemic.
I think obviously that's incorrect. That's obviously it's a pandemic. But I actually believe that when all is said and done, and a widespread antibody test has been administered to the entire country, I think that we're going to find out that the mortality rate of this is roughly 3 times more than the flu. I personally believe that.
Well, even if it is 3 times more than the flu,
of
it's
course
3 times more than the flu.
But does that justify unemploying 20 million people? That's the question. That's the question. Does it justify dropping the workforce by 16% and setting back the economy, 5 years in the process? That's the question. And the answer, and you're going to say it's all about saving lives. And I'm going to say, well, Brian, 8,000 people die every single day in the United States.
So what's your point?
In New York, 440 people died every single day last year in New York.
So what's your
point? I'm saying people die, Brian.
These are people on top of that, though, JD,
and they've died, and they've died since the beginning of time, and they will continue to die.
These are people that didn't have to die, though, because it's a pandemic. It's a pandemic that is
8,000 people die every day from all sorts of different things. It could be car accidents. Could be any type.
And right now, hospitals are actually getting compensated to put people on ventilators.
And why shouldn't they be?
And to list deaths as COVID-19.
So again,
you've had 2 governors come out and basically say, even if there are just symptoms present and there's not a coronavirus confirmed test, we're still going to count it as a coronavirus COVID-19 death.
Yeah, but how many deaths, JD, out there that we don't know about because they're at home and they die at home of COVID-19? We don't know about those deaths. So it kind of offsets it, right?
You're saying someone at home gets COVID-19, even though they know
that they die from they don't know.
They know all. But they know all the symptoms. They know, because right now, if you're at home, you know what this is. I don't think there is 10,000 Americans out of 330 million that don't know what COVID-19 is at this point, in my opinion. So if you have those symptoms at home, you're telling me that you are just not going to the hospital, or you're not being treated at the hospital, and you're just dying at home. I find that extremely hard to believe, Chris.
JD, all I'm doing is pointing out that you're trying to say that numbers are getting inflated in hospitals, and I'm trying to point out that there are we don't know how many people that are dying from COVID-19 that are at home that we don't know about. Hold on,
Chris.
I'm just trying to offset it.
Let's just go with facts.
Yes.
Fact.
Yes.
You could have the coronavirus and not know it. You're forgetting about that. Number two.
Why would you die from if you didn't know it?
There are a lot of people out there that have the coronavirus and don't know they have it. Fact number two.
But you're not going to
Hold on,
die of that.
If I could just finish.
You'll be asymptomatic or mild.
No, if I could just finish. There are a lot of people out there that refuse to go to the hospital and they're sick. Now, you could make the statement, well, you know what? That's on them. But there are a lot of people that have died that have not taken that step to go to the hospital. That's number two. Number three, when you say 8,000 people die every day, there has to be a point to you saying that. So I ask you a question. Why would you bring up 8,000 people in America dying every day? Are you trying to correlate that to we should open up the economy now? Why do you say that?
I've never once said we should open the economy.
So why bring that up?
I literally said, Brian, in the last 20 minutes, I said we should open up the economy based on the positive testing rate of states that
We
are not
don't have enough tests.
that are not considered
Testing's
hotspots.
not even close to what it should
Chris,
be on par.
there's been 3 million tests in the United States.
And how many
so
people
far.
live in this country?
In one.
There's
Why would you?
330 million people in the country.
Okay, so why would you over test in an area where the positive testing rate is low just to see if it's legitimate? The testing as of now, like for example in Utah, you can get tested in what? 3 or 4 high population areas. Why would there be during this lockdown? Why would there be thousands and thousands of asymptomatic cases just hiding out there? No one's even congregating at this point.
Here's what I'll say.
But now in a place like New York or Philadelphia or Boston or Detroit or New Orleans where it's higher than 25%, yes, I would not be shocked right now if in New York City that half the population has this virus. I would not be shocked at all if by May 1st, if let's say 5 million antibody tests get administered in New York, right, which is 8.4 million population. But if by May 1st, if half the population did not get this virus in New York City, because there's 8.4 million people, they live on top of each other. Public transit is huge. There's not a lot of cars there, and the virus is airborne. For example, it can stick on the bottom of your foot, Brian. I mean, in ICUs,
You're making my case for me.
Yeah.
It's very spreadable. It's a very spreadable disease, and we don't know it.
Which drops the mortality rate, Brian, because it's all about the deaths in the grand scheme of things as far as how deadly the virus is.
How do you come to that conclusion?
Because if right now, we have 560,000 confirmed cases in the United States, right? If that number is actually 4 million, factoring in the asymptomatic cases, and we've had 23,000 deaths, that drops the death rate to the flu right there.
And again, I'm going to ask you the same question. You throwing out all these numbers, and again, it leads me to the same question over and over again. What are you trying to say? You're saying that we should open up when? I don't understand.
No, I'm saying that when all this is over and said and done, I believe at this point, based on what I've learned about this virus, it will probably be the biggest overreaction in American history.
And you don't think the scientists and the doctors have learned anything either? I mean, what are they just overreacting?
Brian, the scientists and doctors have literally based all of their decisions on a model. And the model, the IHME model, which is the one that yes it is.
Not all of their decisions.
Which is the one that Fauci and Deborah Birx presented to everybody over the last month on the White House task force briefings. That model has been grossly incorrect. And the decisions were based on that model. Right now, that model it predicted 61,545 deaths as of 2 days ago. Right now, there wasn't expected to be a drop down to 1,528 deaths until a week later. We're 1 week ahead of schedule based on deaths at 60,000 according to the modeling. That number went from 2.2 million to 60,000. Brian.
Okay, I mean, listen, I just completely disagree with you,
and you're welcome to do that.
And the bottom line is this: and you're right. I put innocent lives over the economy. Now, I have no doubt that whether we're back in 4 months or back in a week, I hope it's 4 months, actually, because I think that would be more responsible. But I believe that the economy will get back on track. I believe people will get back on track. I believe that small businesses will be able to get back on track. Here's what we can never bring back. Somebody who dies. Somebody who is 6 feet underneath the ground. We can't get back to that. We just can't. If somebody loses their life, we can't bring them back to life. The economy can be brought back to life. We'll get past this. We will get past this. But, again, my friend lost his mom. She can't come back. She doesn't care whether the economy comes back or not because she's dead. And that's what I think is a lot more important than the economy. So we got to take a quick break. And when we come back, we will be joined by one of the most prized American Olympians of all time, gymnast Shannon Miller. The Olympics have been postponed. We'll get to that when we come back. You're listening to the Vegas Take right here on the all-new 101.5 FM. 7:20 a.m. KDAWN.